think the mass population perceives physical therapy as a bunch of exercise and maybe even some pain with torture and all these other reputations that are built up in the community. And I think, for one thing, a physical therapy treatment actually isn't really the most important thing, and I don't think it's anywhere near as important as establishing a correct diagnosis. Too many times in my practice over the years have I had patients come in that were misguided for 2, 3, 4, 5 years, until they got to us and we really stepped back and said, well, wait a minute, there's some missing links here. I had a patient the other day come into my office, real sweet, 79-year-old woman, and I was very disappointed after I spent maybe about 25 minutes into our examination. And this woman was beside herself. What a beautiful, wonderful lady, sweet lady, and she was a local politician, very well respected in the area and in her career field. And but it doesn't matter what people do for a living. It really hits home when someone comes in and says, with a tear in her eye, that she was walking around the kitchen with a big pan of pea soup, and she fell on her back almost down the cellar stairs and spilled this pea soup all over the place. And that doesn't seem like such a big deal, but that hits home because that affects the life of somebody that didn't know difficulty, didn't know problems with function, didn't have a problem going up and down the cellar stairs, let alone walking. So this poor lady thought that she was coming to me because she was losing her balance. Well, she was correct. She was losing her balance, but the thing that was disappointing to me is that she was progressively getting worse over the last 3 years. She went to another physical therapist for 2 years straight. She's been to several physicians, and within 10 minutes of a physical exam, and we spent about 25 minutes in, but within 10 minutes of a physical exam, it became very evident to me that this woman had one particular muscle in her hip that was absolutely paralyzed, okay? So in this muscle, this particular muscle is responsible for when you're walking to stabilize, when you walk, you're on one foot or the other. And when you're on the stance leg, the one muscle on the side of your hip abductors, need to stabilize your pelvis so you can bring the other leg forward. Well, the thing is, this woman's right side hip abductor was paralyzed. And we'll get into, the cause of that a little bit later. But the point is, it was paralyzed, so it wasn't stabilizing her pelvis. So when she tried to bring her other foot through, and that muscle made the pelvis collapse, her leg would swing across and she had kind of a scissor gait. And that's why she was falling all over the place. So everybody knew that this woman had an abnormal gait, but nobody identified over the past several years why she had a problem with her gait. So in the very first couple of treatments, we did a couple of things. Number one, I looked at this woman and I said, you're a very successful career woman. I said, but you're gonna swallow some pride here, because you're not gonna be spilling pea soup and falling down the stairs and going in the hospital with a fractured hip and ending your life. You have a lot of years left in your life and you're gonna live them. And the number one thing we're gonna do is we're gonna give you a safe walking device so that you can't cause yourself to have a scissor gait because of this paralyzed muscle. That's number one. Number two, I'm gonna send a very detailed 4-page report to your physician, letting him know that I identified this and that the origin needs to be delineated. We need to find out why. I have my suspicions, but we need to confirm my suspicions why your hip is paralyzed, and we need to go from there. So further on down the road, we found out that my suspicions were correct. This woman had a severe case of spinal stenosis, which was encroaching her spinal cord. And when you encroach your spinal cord, you interrupt your nervous system's communication with your muscular system. And so this woman's muscles weren't working properly. So the question at hand here is, number one, what will we do about this? How will we manage this condition? We're not going to reverse it. We're not going to take it away completely. How do we manage it? Well, my thought process was, first of all, this is a grown woman reaching the end years of her life. She deserves to know what is wrong with her exactly and know what her options are for management of this condition. No matter what the risks are, it's her right to make a decision on how she wants to manage it. Whether it's a surgical procedure and all the risks involved, or does she want to let this condition go because it is progressive, the spinal stenosis, it's progressive, and she will end up in a wheelchair and not be able to walk at all. So the risks of surgery may become less prominent, okay, and less of an issue for her. Now, if she goes in and has a decompression of her spine, there's a chance that she could have the ability to walk for several more years. So we need to, so the idea, what I'm getting at is physical therapy is not just exercise, is not just treatment. Good physical therapy is sitting down with a patient and really, really spending enough time in the beginning, putting the commitment in to find the absolute proper diagnosis, because without a diagnosis, a correct diagnosis, you can't give value to people.